हेलो हाय आदाब और सत श्री अकाल और एक बार फिर से आ गया हूं मैं आप लोगों के बीच आपका हमराज आरजे हमने 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी पर और दोबारा से आप लोगों के लिए लेकर आया हूं आपका फेवरेट शो नो योर फैकल्टी। जैसा कि आपको पता है इस शो में हम एक फैकल्टी को किसी एक डिपार्टमेंट से किसी एक स्कूल से इन्वाइट करते हैं, उन्हें बुलाते हैं और उनसे करते हैं कुछ सवालात, उनके बारे में जानते हैं और वो बातें भी जानते हैं जो अब तक आप नहीं जानते थे, और उनका टीचिंग मेथड कैसा है और उनकी निजी जिंदगी में भी वो किस तरीके के हैं। आज एक और ऐसी शख्सियत है मेरे साथ स्कूल ऑफ पब्लिक हेल्थ से, जिनका नाम है डॉक्टर दक्षा परमार और वो एसोसिएट प्रोफेसर हैं स्कूल ऑफ पब्लिक हेल्थ में डी वाई पाटिल यूनिवर्सिटी में। आज हम उनका वार्म वेलकम करते हैं यहाँ पर और उनके साथ शुरुआत करेंगे सवालात का सिलसिला। गुड मॉर्निंग डॉक्टर दक्षा, कैसे हैं आप? हाउ आर यू एंड वेरी वार्म वेलकम हियर।
Yeah, thank you. Good afternoon, Abhinav, and thank you for giving me this opportunity to meet you. And it's a very good initiative. I hope I will be able to stand your
the question and answer session. The pleasure is all mine. Okay. पहले इसी सवाल से शुरुआत करते हैं जो सवाल अक्सर हम लोग यूज करते हैं शुरुआत में। Tell us about your journey here at डी वाई पाटिल University. When did you start working here and how have you evolved as a teacher and human being?
Okay, so I joined the university in the month of December 2023, and so I'm almost around 4 months old here at the university. So before this, I was working as an assistant professor at the Indian Institute of Technology, IIT Guwahati.
Oh, wonderful!
And I was a faculty of development studies at the Department of Humanities and Social Sciences, and I was teaching a number of courses there in public health and development studies, and I worked there for almost more than 6 years. And since I am from Mumbai, I wanted to make a shift back home, and I applied here at the School of Public Health at डी वाई पाटिल University, and I'm glad that I got an opportunity here to be as an associate professor.
And then actually you finally came back in Mumbai.
Yeah, so I came back home, and thanks to डी वाई पाटिल University, almost because I left for my higher education in 2009, and I came back home after almost 13 years or so.
Okay. Yeah. What made you choose the field of public health? How did you prepare yourself for this since school and college days?
Okay, so I didn't prepare myself since my school and college days, to be very honest. I was doing during my college days BCom, like I'm a graduate in commerce from Mumbai University. I studied at Vivekananda Education Society College of Arts, Science and Commerce. It's in Bhakti Bhavan in Chembur. Yeah, so during those days, like this is early 2000s, I was really thinking I'll complete my BCom and do my CA as every commerce graduate things. But then something changes in 2005-06. I gave an entrance for this prestigious institute called the Tata Institute of Social Sciences. I gave an entrance for MA in Development Studies and also Masters in Social Work. And I qualified both the exams, and that's how I made a shift from commerce to pursue my Masters in Development Studies at Tata Institute of Social Sciences, Mumbai. And then this course of 2 years that I studied as a development studies course, which was one of the first courses, or a new course started by TIS in 2006 when the institute underwent some restructuring. And it was here while I was, studying that I got introduced to a number of social science ideas, concepts, theories that made me interested in the field of, the society, understanding society, our issues, and as a part of this 2 years Masters in Development Studies course, I did a master's dissertation on understanding the nutritional health status of tribal children. And from there, like that master's dissertation made me understand the complexities of health, public health, the interlinkages with nutrition, and like it was through that in I still remember doing field work in the villages of Jawahar and Mokhada in Thane district of Maharashtra, and from there I began my journey of understanding the whole the theory and going ahead further in the field of public health. So that dissertation was one of the starting point. Later it was the internship that I did with UNICEF Maharashtra, where I was working in the district of Latur, particularly working on health and micro planning. And it was there at the in the team where I had one of our mentors, Dr. N. Nakiran, who is now teaching at Ambedkar University, Delhi. So he was the UNICEF head, and he was the one who motivated me to go ahead in higher studies because of my keen interest in the area of public health, and also my teachers at the Tata Institute of Social Sciences. So the internship plus my dissertation plus my teachers, who really saw that I was very interested and I had questions for further knowledge for going into, and that's how I went to for my higher education, post-graduation, MPhil and PhD in public health from Jawaharlal Nehru University, from the Center of Social Medicine and Community Health. So it is something which started after my, like at my post-graduation.
That is actually a small journey of yours.
Yeah.
Nicely explained. Okay. Dr. Vijay Patil sir is an inspiration for all of us. How has he motivated you?
Yeah, so I haven't met sir personally,
Okay.
but I heard him twice. One was at the musical concert, if you remember, that we
Oh, okay.
had with the trio in from the Austrian musical
Oh yes,
concert
actually
in
that band came.
the band
especially
which came. So
in
sir
the town
spoke.
hall.
Yeah. So sir spoke after the event, and I really liked the way sir, encourage young students to form musical
band, yes,
for the
yes.
university. So I was really amazed, because that's something very different, right?
Apart from the academics.
And secondly, I heard him at the university convocation that I attended, the way in which the new programs have been started. I also read a interview of his in the recent issue of Education Post. I
Okay.
had gone through the entire interview, so I was also very impressed by the way sir has a vision for the growth and expansion of the university with the the National Education Policy 2020 that the government
Oh,
has
yes,
formulated.
LEP.
So I really like the vision that the sir has for higher education, and the need for having students build their critical skills, critical thinking,
Yes.
necessary for today's time that we are living in.
ओके आपको सवाल पूछता हूँ मैं आपकी फील्ड से आई थिंक यू रेडी फॉर दैट ओके ओके नाउ द मेंटल हेल्थ इज गेनिंग मोर अटेंशन एज एन एसेंशियल एस्पेक्ट ऑफ ओवरऑल वेलबींग हाउ डज पब्लिक हेल्थ कंट्रीब्यूट टू मेंटल हेल्थ अवेयरनेस एंड challenges?
Yeah, so mental health, if you look at the definition of health also, there is a lot of focus on well-being, both physical,
Yes,
mental
definitely.
and social.
Yes, you
So,
can't especially remove your mental
yeah.
from your overall health.
Yes, so
Yes.
so we need to understand that our health is not only about diseases, but also the fact that we have to constantly adapt and feel wanted. We also have to understand the challenges that different age groups undergo as they are living in a rapidly changing
Yes, as especially with this Gen
generation.
Z generation back
Yeah.
who are having the anxiety and depression actually in the meantime, especially.
Yes.
So much
So
easily.
one of the most important thing that I think that needs to be dealt with when it comes to mental health is the fact that there is a lot of stigma. So related to mental health conditions, right? People don't openly accept the fact that we might have certain conditions which might need
Even
professional
still now,
help.
yes,
so,
yes.
so one I think is the fact that now the people have become aware, but still people find lot of challenge and particularly stigma, because the fact that this person is not normal. So we also have to understand what is normal and what is abnormal.
Okay.
So those definitions, those challenges, we really need to work towards, and most importantly, we need to create awareness of the fact that we need to also address the health needs, particularly the mental health well-being, and we need more trained manpower. There's a huge shortage of psychiatrists, doctors. We also need to do a lot of community-based initiatives where people who are suffering from different kinds of mental health challenges, I would say, and conditions, get the proper needs at the right time, rather than putting or providing them with only, say, medicines or So there are like conditions which can be addressed at the community level. Family is a very important support system. So how, say, so social workers, the community people, then doctors, like the social workers working in partnership with the psychiatrists, doctors, and other mental health professionals, counselors are also very important aspect of our health workforce, which can provide a very important support system to everyone who are suffering or have different kinds of conditions. Yeah.
Okay, nicely explained. Now, emergencies like natural disasters or disease outbreaks can strain public health systems. How do organizations prepare for and respond to such challenges?
Yeah, so I'm sure we all have lived through one of the most deadly
COVID-19
pandemic, and I think that has been like one thing that we all should learn as public health professional and also individuals living in these times, that we need to be prepared for disaster or and pandemic of this kind, which had created so much crisis in the world. The world that we thought that we lived in, which was so interconnected, which was so technologically developed, but a virus, an infectious disease,
yes, definitely,
that the pandemic
it can actually change
shaken.
everything.
Yeah, it has changed the way we interacted, the way we lived, and also a massive economic crisis apart from the health crisis. So what I think is the fact that now the most important lessons that everyone, particularly individuals, populations, communities, and the government, and also different sectors have to learn is the fact that we have to be prepared and build our systems, be it health systems, be our community network, to handle the challenges thrown up by any kind of disaster. So the more we are prepared, we need to undertake more and more research. One of the preparations is the fact that we learn what are the crises, how did we address it. We do research, we invest in strategies which will save lives. So there is a need for more allocation. We also use technologies. We learn from different countries the way they address the problems from, say, natural disasters. Like one of our best states when it came to natural disasters, Odisha, the way they have built their disaster management systems,
yes.
particularly after the cyclone. So I think there are a lot of lessons to be learned. Most importantly, to build systems in place which will cater to people's need in times of crisis, to plan what to do when a crisis comes, to plan to have more manpower, more funds, more technology. Most importantly, to minimize the risk of the disasters or any kind of global, infectious disease, epidemics or pandemics. And most importantly, to ensure that we are resilient enough to, the system is resilient enough to strike back and come back to its, like, it doesn't cause us much more damage, but ensures that we save life and property.
Okay. Do you need water? Try to do that. Okay. What makes our institution unique? Of course, it's the faculty like us, definitely. But what about the factors and such as infrastructure, cafeteria, lab and research facilities, the varied courses, and the general environment of learning and fun?
Yeah. So when I first entered the university, I was really amazed by the infrastructure.
Oh yes, the campus.
So when I came here for my interview, so the building, the Center for Excellence, where I am working, and I have an office. I really like the way this building is structured. I am still to explore the other buildings and the other schools, but I really enjoy studying in the library. So I also like our Knowledge Resource Center in our Center for Excellence, where I go often to study and read. Now it has given my work, I have stopped doing that, but initial first 2 months I was a regular reader there. I also like the cafeteria. It's quite spacious and
the Island Cafe.
But there are two, right? So even the medical school.
Oh yes, they have the Legends Cafe.
Yeah, the Legends.
We have Legends Island, the Garden Cafe. It's here.
Yeah.
So much cafes are here.
Most of my time has been in the Island Cafe. Yeah. At the Center for Excellence.
Oh, Center of Excellence building.
So I think all the infrastructure is very nice, and it's like the state of the art infrastructure.
Okay, now some questions from your personal life. Okay, what is the greatest lesson you got from your students?
Oh, my students have taught me a lot of lessons, because I often tell them it's teaching is a two-way process. It's not only the
yes.
fact that I am teaching you, but I also learn from you.
Correct.
So all my students, be it like, this is particularly from, because I am too new here, but when I reflect back, my students, my BTech students, when I taught at IIT, my master students, some of them I have interacted at the master's level here also, and most importantly my doctoral students, I have learned a lot from all of them, particularly in terms of managing their times, the time management that they do, because they are studying multiple courses. Most importantly, they are also very creative, like some of them writes poem, some of them publishes their poems. One of my PhD student has published a book in Bangla.
Oh wow.
And in Bengali, and he has
okay.
written his entire experiences of living through a pandemic in a tea garden of West Bengal.
Okay.
So I have
wow.
learned a lot from my students, because they come with new ideas, they are very creative, and they are multitasker.
Okay. What do you do in your free time? How do you juggle your hobbies with your career?
Okay, so I hardly get quote unquote a free time,
The
because
free
I'm a
time,
working
especially.
woman and a working professional. But I try my best to take out some time when I'm traveling to work by the train. So I often read.
Same here, especially.
And
I actually
most-
carry the book in my phone.
Yeah.
That is the only way.
That, because rather than looking here and there, I prefer to read a book, and I also knit. So I like knitting when I'm cooking,
okay.
when I'm standing in the kitchen, to ensure that I don't forget that I'm cooking. And so reading and cooking is sometimes which I can multitask while traveling or while cooking. And during my free time, I really like gardening. So that has been my three hobbies. If at all I get some time on weekends, that I do gardening.
Okay. So now our famous rapid fire round. I think you're ready for that. Okay. The best advice you got in your career?
Okay, so from my teacher with whom I had worked after my PhD, he told me to be a doer and not to give up things, and most importantly to take up more work, so that I learn at a young age, and mostly to be a multitasker.
Oh yes.
Yeah.
The happiest moment of your life?
Okay, there are many, but one of the most happiest moment in my life was when I had received an grant in aid from
Nice. Wow.
the Rockefeller Archive Center in Tarrytown, New York. I was one of the first doctoral student from an Indian university to receive this grant to spend time at their archive center in New York for 3 weeks, and to do archival collection for my doctoral thesis that I had submitted in JNU. So I was very proud that I received this fellowship from this prestigious institution.
Oh wow. Okay. The saddest moment of your life?
Okay, same. There were a lot, and there have been a number of saddest moments, but I was really at my low, sorry, when I came to know that one of my dear friend passed away in the second wave of COVID-19 pandemic. Her name was Kekali, and we were
Sure.
together in JNU. We were studying together for our doctoral program. So
And
unfortunately,
you also actually feel very sad because you are from the public. What
Yeah.
can I do?
Yeah.
Should I
So-
do something?
So one of the most meaning that I came to know, because I was in Guwahati then. So the friends we were in touch with, we came to know that she didn't ask anyone for help, because it was the most difficult time that all of us
Crucial
was going
time.
through. The second wave, as you
Okay.
might know,
Oh,
was
yes,
most
yes.
deadly. So she was a person, she didn't share with any one of us who were there close to her in Delhi that she is going through this. By the time she reached out, we came to know that it was too late. So that anger that has remained with us, that we couldn't do anything to save her life.
Okay. No,
Yeah.
sorry for that.
No, thank. It's
Okay. Now, the challenging moment of your life. Now, apart from that actually you will say every day is a challenge.
No, there are a lot of challenges. But one of the most important challenge is to navigate through maps. I'm not so used to map, and second most important challenge I face is often during turbulence that I would travel, like, before this I used to come
Okay.
to Bombay often every month because my family and my husband are here.
The flight and all.
So the turbulence that we get as we reach Guwahati, so that is one of the most challenging.
The map is actually same with me. But I know the place when actually I'm going there physically.
Yeah.
But if I'm actually seeing them in map, I don't get the idea where to turn and
True.
when to turn.
But I
That is
really
actually-
want to overcome that challenge because it helps us in terms of using the technology.
Yes, definitely.
But that has been a challenge.
At least GPS is actually
Yeah,
helping
yeah,
us.
yeah.
Okay. Which actor is your favorite?
Oh,
If you
Johnny Lever.
ये लीक से हट करता. Okay. Favorite book?
Oh, favorite book again. Many, but one of the books that made me reflect and think through is this book called, which I often suggest everyone because I found it really interesting. The book is titled as When Breath Becomes Air. It's written by this neurosurgeon called Dr. Paul Kalanidhi,
Okay.
who was working as a neurosurgeon in US, and he was diagnosed by stage 4 cancer, lung cancer. And so the first part of so he has written the book in this is a memoir, like it's an
memoir.
autobiographical form which got published once he passed away in 2016. And a friend introduced me to this book, and I really admired the way the book was written, because it was all, the first part of the book is he being a doctor as a physician, his
Okay.
education as medical education and other things that he did in US, and the second part was him as a patient.
Oh.
And the fact that he knows that he will be dying. Okay, so it was all about mortality, it was all about nearing your death. So something that I was very scared of was about death, of losing your loved ones. That was something I had a fear of. But that book made me understand that you have to live, because death is something that all of us will be facing once in a life. And the fact that the author is writing about he will be dying in sometimes or in few years. So that experience of facing death and living with it was a major learning for me. So that's a very interesting book that I had read.
Your favorite movie?
Okay, many again, but one of the most recent, I'm sure you might have also seen, the Lapata Ladies.
Achha,
Lapata Ladies, directed by Kiran Rao.
Kiran Rao, huh.
So I'm sure you will understand, but since I have watched the
The
movie.
two of actually, my friend actually worked in that.
Nice movie, and also the fact that it talks about self-discovery of two women in our patriarchal society, given in a satirical way. But
That is a satire.
so apart from the stories of two women like Pushpa and Fool,
Who actually
the two
got misplaced, yes.
got swept. But I also like the character of I'm forgetting her name, that Marathi actress,
Okay, no issue.
and Ravi Kishan.
Ravi Kishan.
Yeah, the
Oh.
message that he gives, in terms of supporting women's education, the importance of law to protect our dignity and rights. So that was something that I think that needs to be highlighted. And also the whole journey of self-discovery and empowerment of women in our context, which the society is very patriarchal or
Oh, okay. Your favorite food?
non-veg.
Non-veg. Okay.
My favorite food, if you
favorite
want.
food. The particularly one?
Yeah, so my mother makes very nice fish curry, and my
Oh.
father makes very nice prawns patties. So I like
yeah.
that.
Okay. Your favorite holiday destination?
Okay, Scotland, because the day are very long there, and the city could be seen on, by walking. It's very beautiful, and I like the fact that the day is a very long day. Till 9 o'clock there is a sunrise.
That's great.
Sunlight.
At least
Sorry.
actually we can work. Oh, हाँ.
Yes.
जैसा कि हमने insomnia movie में देखा था. Okay. Now some insights of your life. Okay. An idea that changed your life.
Okay, a lot of ideas, but the whole idea that higher education can make you, and a very important part of my life was the fact that my teachers encouraged me to go for higher education. And that was a very changing idea, that because I had never thought of going for higher education. I was thinking commerce ke baad CA, but
So that was the idea.
that was my thing. But then this changed and I became a faculty. Like that idea of going for higher education and to do things differently and something which can be done passionately. So that was the whole idea.
The best role of your life: mother, wife, daughter, teacher.
So I don't have any children. I'm not a mother.
Okay.
So best role is that I'm a daughter, and second comes teacher, and the third as a wife. All
Okay.
three are important for me because that's what I do every day, juggling my working life, my personal life as a daughter and as a wife.
Okay. Do you cry sometimes?
Yeah, many times when I am confronted with certain situations which I'm not able to address, and also when I'm say lonely. But then I try to like take advice and do a lot of self-talking and identify how to navigate through life.
Okay. Now this or that round, I'm giving you some option, and actually you have to choose one. Okay.
Yeah,
Veg or non-veg?
non-veg,
Okay. Tea or coffee?
coffee,
Gym or yoga?
gym,
Early riser or night owl?
early riser,
Okay. Emotional or practical?
rationally practical,
Books or Kindle?
books,
Mountains or beaches?
mountains,
Okay. Religious or spiritual?
no,
Acha, okay.
none,
Library or classroom?
classroom,
Okay. Amazon Prime or Netflix?
Amazon Prime.
ओके दैट वाज वेरी मच नाइस। और बहुत खूबसूरती के साथ, खूबियों के साथ यहाँ पर हमें आंसर दिए थे डॉक्टर दक्षा परमार ने। और जल्दी हम लोग दोबारा उनसे मिलने वाले हैं न्यू ईयर डिपार्टमेंट में। थैंक यू सो मच, बने रहिए हम लोगों के साथ 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो पर। थैंक यू सो मच दक्षा।
Okay, thank you, Abhinav, and thank you for helping me go through all the questions which made me think and reflect on my life.
Actually,
thank you.
there were a lot of questions there.
Yeah, but this was also like quite long.
Oh yes.
Thank
Okay, it was
thank
nice
you for
one.
this opportunity.
My pleasure.